Hi, my name is Sonia Lehenan, and I'm a final year student in the Department of Anatomy and Neuroscience in the University College of Cork. The topic I'm going to speak to you about today is stress and pain in neonates admitted to the intensive care unit. This presentation is based on the literature review I conducted during the course of my final year research project. This research project was conducted in conjunction with INFANT, the Irish Centre for Fetal and Neonatal Translation and Research, which is based in Cork University Maternity Hospital. So the neonatal period is defined as the first 28 days after birth. During this period, major physiological events occur which are necessary for the transition from intrauterine to extrauterine life. These include the change from the fetal to the neonatal blood circulation, the activation of the respiratory and the gastrointestinal systems, as well as the continuation of brain development. As a result, the neonatal period is an extremely formative and vulnerable age, and can be especially challenging for sick neonates. Neonates who have undergone a traumatic birth, who have been born prematurely, as well as being diagnosed with other health issues, are admitted to the neonatal intensive care unit and the special care baby unit. As a part of their ongoing care, a significant number of procedures are performed, and these procedures can be a cause of pain, stress, and sleep deprivation. This table provides you with a number of procedures that are performed in the NICU. Feeding is done in every single healthy or sick neonate. However, it becomes a procedure in the NICU when it is done through orogastric or nasogastric tubes. The insertion and maintenance of these tubes may be a cause of pain and discomfort. Changing nappies are, yet again, another thing that is always done in every single neonate. They need their nappies changed. However, when you're in the NICU and you're dealing with neonates who are hypersensitive and who flinch with pain at every single touch, these can become a challenge and another source of pain and stress. Intubation, however, is a procedure that is only experienced by sick neonates. It is performed when there is restricted respiratory breathing and the neonates are not responding quickly enough to bag and mask ventilation. A tube is inserted down the trachea in order to assist with breathing. And to try and avoid causing the neonate any pain or discomfort, fentanyl is given prior to intubation. A peripheral blood sample is anything from taking blood from the IV to a heel prick test, and it is frequently done in the NICU. Sucrose is often given orally to try and calm the neonate. The use of analgesia and sedation is not something that was practiced in the NICU until up to 20 years ago. Prior to 20 years ago, there was a belief that neonates could not feel pain, that their system to the brain, which signals for pain, was not developed, and therefore there was no need to give them analgesia or sedation. Sleep is important for development in both healthy and sick neonates. However, achieving adequate sleep in the NICU is incredibly challenging. It is, however, important as sleep is necessary for the brain development and maturation. The NICU can be a bright and noisy environment. Day and night laboratory tests, neonatal exams, and treatment procedures are performed. While the nurses try to respect the sleep-wake cycle of the neonate, this is often unachievable, and it results in a continuous but unavoidable disruption of sleep due to handling. Hence, repeated procedures interfere with the quality of sleep a neonate gets, resulting in sleep deprivation. They may also increase the levels of both pain and stress in the neonate. This could potentially have long-term effects on neurodevelopment and neuroendocrine response to stress. Early exposure to stress may lead to abnormal human reflex development, resulting in abnormal motor system development. During the neonatal period, the brain continues to develop its neural pathways, and this process is more intensive during sleep. In the case of sleep deprivation and stress, these developing neural pathways are often forced to take an abnormal route, which results in abnormal brain integration. It can be concluded that the increased number of procedures experienced by neonates in the NICU during the neonatal period may increase levels of both pain and stress, as well as lead to sleep deprivation. They may also have a detrimental effect on brain development, and therefore the number and duration of the procedures in the NICU, as well as their effect on the long-term neurological outcome, requires detailed investigation, which would help optimize neonatal care. This is what I am looking at in my final year research project. I am taking videos of neonates in the NICU, and over the period of 12 hours, I'm looking at how many times they are touched by a nurse and by a doctor, as well as by their parents, and seeing if this has an effect on their neurological outcome. Thank you very much for listening.